Okay. Hi, everyone. We're going to get started in a couple of minutes once everybody logs in. I hope you're here for IEPs and evaluations during COVID-19. Hi, everyone. Thank you for joining us. We're going to get started with IEPs and evaluations during COVID-19. Kim, can you put us back to slide 1?
Oh, sorry. Yep.
So thank you for joining us. This is IEPs and evaluations during COVID-19 presented by Advocates for Children. My name is Janelle Canals. I'm going to be co-presenting with Kim Madden and Maggie Moroff. Just to get started, if you have any questions throughout the presentation, please put your questions in the Q&A section. We will try to answer questions in the Q&A while also answering it live during the presentation. So please feel free to write your questions in as they come through the Q&A section of the presentation. If you would like to hear this in Spanish, si quieres escuchar esta presentación en español, por favor, llama el número que vamos a presentar ahora y entra la contraseña cuando pregunta para la contraseña. Si tienes preguntas, puedes escribir sus preguntas en español en la sección de Q&A o preguntas y respuestas. Y ahora vamos a empezar con Maggie y Kim. Now we're going to start with Maggie and Kim.
Great. Hi, everybody. I just want to introduce myself, and I'll be talking to you later. I'm Maggie Moroff. I'm the Special Education Policy Coordinator at Advocates for Children, and I'm looking forward to this next hour.
Hi, I'm Kim Madden. I'm the Director of Family Support at Advocates for Children, and I'm glad you're here. It's something that we've been working on for a little while, and we had hoped to have all the answers to things, which we fortunately don't. But we're going to take you through what we know so far, which is true for as we go through this whole period together. Sorry, hold on. Okay, so the agenda for today is, we just did the introductions. We're going to go through referrals and evaluations and how that works during remote learning, IEPs and how that works now, and then the implementation of IEPs and remote learning plans. And at the end, we'll talk about some advocacy tips. And throughout it, we are going to pause for questions. And as Janelle said, please put them in the Q&A. Okay. And just to let you know about AFC, we're an independent agency and we protect the rights of all New York City students. Our helpline is still open. It's Monday through Thursday, 10 to 4. We have people answering the phone. So please give that number out to your friends and families. There are people that speak English and Spanish answering the line. And we have a whole lot of resources on our website. And we do workshops and trainings and legal services for low-income families. And it's only New York City for the legal services part of it. For the COVID period, we do have on our website a whole lot of updates. The page on this is updated pretty much daily. So please log in, and as we get more information, we'll put it up on there. As I just said, we were hoping to have a little bit more information about some pieces of the evaluations and remote learning plans than we do right now, but as we get that information, we will share it. Okay. Yeah, we're going to do a poll first. We're going to start with polls throughout each section. Okay, and if you could just answer if you're a parent, an educator, another professional, or a student school age, that would be great. And we'll wait a few minutes for people to let us know who's here. That's always really helpful. Okay, should we move to the next one? All right, so a slight majority professional, and a number of educators and parents as well. Great. And the next poll we have is to ask what you're most interested in learning about today. Are you interested in mostly learning about how the DOE is doing evaluations during COVID-19, how they're holding IEP meetings, or how you can request special education help? And this will just help us, although we're going to be covering all of these topics in the presentation, it gives us a little bit of an idea of what we might want to emphasize. Okay. So the most popular answer is the one that we know the least about, although we don't know a little bit about something else too. But we'll tell you what we know about evaluations, and that's where we're going to start. So thank you so much for that. Okay, so we have another question, and I promise we'll do presentations, but this is a question about, what do you think? Can a parent make a referral for special education supports during COVID-19 school closure? Yes or no? And we'll give you a minute to answer this one. Okay, so do you have enough of an answer there? Yes, okay, that's great. So that's good news, because that is in fact the correct answer. You can make a referral. So to refer your child for extra help, for an initial or a re-referral. The process, the first part is the same as would be not during COVID, but you would email the principal if you're in a public school, and email the CSE chair if you're in a charter school or a non-public school or not enrolled in school right now. So that's the same. But the other piece that we are recommending people do is to email the email that's on the screen right there, specialeducation@schools.nyc.gov. And that's because there have been some issues with schools not knowing exactly what to do, or people having trouble finding emails. So ideally you email the principal or the CSE, and but if you can't email them, you can email special education, and it really might make sense to email them both. So that's what we're recommending. Also, to let you know, throughout this presentation, for when there's links or emails, don't worry about writing it down. First of all, this will be recorded and posted on our YouTube site, but also the hyperlinks that are in here, so you can get to a different web page. We'll be sending everyone who signed in a copy of the PowerPoint, so you can click to it from there. Okay, but then the last one is, if email is not working for you, you haven't heard back, or it's just not something that you can use, you can call 311 and explain that you want to make a special education referral, and they will route you to the appropriate office at the DOE. So that's the third way you can do it. All right, another question. If a student needs new evaluations, the evaluations can't happen until school reopens. I think this is true or false? Or it depends. And this is a tricky one, so we'll give people a few minutes to answer. Okay. All right. Well, that's a really interesting split. To be honest, all three answers could be true, but I think false and it depends are the most correct. And this is really the situation that we are trying to explain as best as we can today. So certainly the IDEA still applies. When this first happened, we were really worried that the federal government and the state government were going to waive a number of provisions. And there was one thing that was waived that we'll talk about later on. But for evaluations, that didn't happen, thankfully. So you still have a right to have an evaluation done within 60 calendar days of consent, and to ask for an evaluation at any time, including now, and to be evaluated in all areas of suspected disability. The tricky thing and the complications that come up with this are that some evaluations, especially cognitive ones, and normed ones in general, meaning they're standardized tests, are tough to complete remotely. And then obviously for some students, depending on their disability, it's also tough to complete remotely, for the same reason that remote learning really varies for each student, how much they're able to get out of it. So this is the trickiest question, and the one that we are still hoping both the DOE and or the state in New York will issue clear guidance on how to do this. You should certainly ask for an evaluation, and you should certainly try to get as much information as you can for your child if they need extra help, or for a family that you're advocating with. So teacher reports, trying to get people to write up what they've seen, there's a lot of scales that psychologists use actually that are not just done in a testing format, that might be parents filling out something. But there are some evaluations that are tougher. Some psychologists are licensed to perform remote evaluations, but most aren't. And so this is the area that I think people are struggling with the most. What we do know is you should certainly ask for evaluations, and don't waive a timeline. Say that you want them now, and if people are saying they can't be done, try to tease out which parts can't be done and what other options there are. and really try to get as many answers with that as you can. So just to go through what's happening and why we're hearing about this on our helpline and through our website and in our casework. So some of the good things that are happening and some of the things I just talked about where parents really are advocating and school staff are being creative is they're holding IEP meetings at times with any available information and being more creative. So perhaps looking at teacher reports, talking to a reading specialist who can try to talk to a teacher, for example, and try to figure out, does this sound like a student who needs supports? Does it sound like a student that may have dyslexia? Does it sound like a student who may have processing issues? Trying to figure it out in lieu of an evaluation that people feel like really can't be done. And we have heard of this happening. And also there's all kinds of disabilities and classifications that, those standardized tests are not the end all and be all. For a student with focusing issue, a lot of times the parent and teacher scales are what they're looking at. And there's really no reason those couldn't be filled out now. So we are hearing some examples of that happening. We're also hearing for initials where it can be tougher, initial evaluation. So a student that has not had special education services before, that RTI, which stands for response to intervention, or sometimes you might hear pre-referral services. But basically, these are services that can be provided to a student who doesn't have an IEP or who's in the process of getting an IEP. You might have heard of, there's different terms for this in the past, but AIS and things like that. But it's basically trying to give some of the services that are similar or even the same that a student with a disability who's classified with a disability might be entitled to before they have an IEP. So a student who has a speech delay, and everybody knows it's a speech delay and they've been able to do things. You might be able to, I actually would say a speech evaluation you probably could do remotely, but putting that aside, you could give speech services through RTI. It's not in an IEP, so it's a different, process and different, it's not protected in the same way the IDEA is, but it's something that could get some help now. So we have seen that. Unfortunately, we've seen a lot more on the other side of the scale, which is why it goes this way. In the beginning, especially, we were hearing from a lot of parents and professionals that students and their families were being asked to withdraw requests for help and say, we know you put in this request, in the beginning of March, but now that schools are closed, you have to withdraw that. You don't have to withdraw that. Oh, just a warning, I'm getting a message that my internet connection is unstable, so I hope somebody doesn't have to bounce in, but if they do, just letting you know. All right, so, and no evaluations until schools open is also something that we've heard. It's a variation on that. Neither of those things are true in terms of, no evaluations. They can certainly do a lot of things now. And we have also heard that private remote evaluations, some parents have been able to secure these because of what I was saying, that some psychologists have a different license, a different certification, are more comfortable doing remote evaluations, have been able to get something privately, and then they've had IEP teams say, we won't consider that. They obviously don't have to accept it and follow it if they disagree, but they are supposed to consider any evaluation, and we've heard the whole range of things. If that's happening to you, that's obviously wrong. And one of the things that you should be doing is writing into the special education email that we had posted earlier and we'll post again at the end. Okay, so that part's wrong, but we are hearing about it a lot. And it's one of the reasons we hope that the city will put out some guidance soon. Okay, so what the DOE is saying, I normally don't do PowerPoints with really detailed pictures of words, but given how little we know, we feel like one of the things that might be most helpful if you're advocating for your child to get support during this time is to be able to point to the DOE website. This is what the DOE is saying on the remote learning frequently asked questions, and it's under special education. You click down and it's saying, what happens, how will my child be evaluated remotely? And it's basically what I was just saying, that they're admitting some evaluations can be done remotely, some can't be, and we're going to work with you to figure that out. But this line here that I underlined, I think is really important. If you're in this situation, and it's the most common situation we've been hearing about, where people are being told, you know, we don't disagree that your child needs help, but we can't do an IEP meeting now because we don't have an ability to do a psychoed or whatever test. And this is the line that I would point to there and say the DOE is saying that it's possible to hold an IEP meeting using information currently available. I wish it didn't say it will often be possible. I wish it just said it would be, it's possible. Because I think that that line is really important. If it's not going to be perfect, if you know, obviously in a different situation, it'd be great to have an in-person assessment. If your child really needs help right now, I would be pushing for what you think they need. The IEP meeting, RTI, something, just being clear in your request that you think your child needs more help. You need to try to get everybody's heads together to figure out what's going on. And then, you know, if it is something where it's still a little unclear, try something for right now. I mean, it looks, you know, schools are now closed through September. Asking for another IEP meeting once in-person assessment has been completed. We are hearing consideration about maybe they can be done at a rec center or someplace else, but we haven't seen guidance on that yet. And oh, I'm sorry, here's the link on the DOE website for this if you want to get this language and refer to it. Also, another place we've been looking a lot is SED. In some states, and I was looking at states across the country to see what's put out, and this is something that many states are struggling with. Oops, sorry. Some states have put out pretty detailed guidance. This is what New York State has put out. It basically said, you know, this is confirming that the 60 days timeline that's in federal law still applies. So if you were referred for an initial evaluation, you know, either before school closure or during it, they have to evaluate you within 60 school days. And so this is the underlined line. But then this is the follow-up question about, can you do everything remotely? And they're saying, well, you know, you may not be able to, so it's got to be case-by-case basis. So that's a really important thing to point to, especially if you're getting the blanket statement of, we can't do any evaluations now, you know, your child needs a psychoed, so there's no IEP. You could say it's got to be done on a case-by-case basis. What other things can we do? And make sure it's not a blanket policy that you're being cited as why something can't happen. And here's the link for that. Okay. And I think next up, we're going to do some questions now, and then Maggie. Okay, so yeah.
Okay, great. As soon as we have the answers to this up, we'll keep moving forward.
Hi, everybody. So before we show the answers to these questions and discuss them, I just wanted to talk about some of the questions that we've got in our Q&A that is applicable to everybody and that we should just be discussing and want to review so everyone knows the answers. We got a couple of questions about early intervention, and we also got a couple of questions about transition from early intervention to preschool special education. For more detail on that, because we're not going to be covering it, we did do a presentation last week that is available on our YouTube site, and also you can access it through our website that specifically talks about early childhood and transition from early intervention to preschool special education. We also got a question about placement offers, which we are going to discuss in a little while, and what happens when the district needs to send the family a placement for the child to go to school. There have been a couple of issues also saying that certain districts are telling families that evaluations can't be done because there just not enough data and that families have to wait until September. Like Kim said earlier, you know, that's not necessarily true. The district can make a determination based on the information they have and revisit it in September if schools reopen then. But they shouldn't be telling the parent no and to wait. They should be making every effort to use the information they have to make determinations. And we're going to talk a little bit more when Maggie talks about how the district is supposed to be doing that during IEP meetings. Another question we have was about impartial hearing requests and impartial hearings. Although we aren't going to be covering that today, impartial hearings are still proceeding and they are taking place over the phone. So if a family does file an impartial hearing request, they can do so and they should be having an impartial hearing. It just will take place over the phone.
All right. I'm going to pick it up from here then.
Now, so we're going to share the results of the questions, and Maggie's going to go over the answers now.
All right. This is a pretty knowledgeable group in that case. So first question, actually, do I still have the right to participate in an IEP meeting to see if my child can receive services? Yes, definitely yes. We'll talk about this a little bit in a minute. None of this has changed. And okay, if my child already received services, do I still have the right to participate in an annual review of their IEP? Again, yes, that has not changed. And if my child already received services, do I still have the right to request an IEP meeting? And as you guys all wrote in the poll, yes to that. So none of this is different. We're going to go through some information about all of this over the next few minutes. So all IEP meetings are taking place over the phone right now. Nobody needs to go into a CSE or to a school building, even if your school building is closed and operating in some other way right now. Before IEP meetings, the schools still, just as before, need to send the parent an invitation 5 days before the meeting. Right now, a lot of those notices, most of those notices are coming by email. So one of the first things that you want to do is make sure that this school has a current email address on file for you if you have an email address. They're also supposed to send copies of any reports or evaluations. Kim was just talking about the fact that some evaluations are difficult to do right now, but they're going to be relying on reports. They're going to have old progress reports. They're going to have old information. They're going to have teacher observations. So you want to see all of that. A couple advocacy tips here. So check your email. As we said, they're going to be coming in. Check spam if you're not seeing it. If you don't have email, or if you have email and you're checking it and you haven't heard anything, there are a couple things you can do, but the first thing we suggest is that you reach out to the special ed office. We've given you the number here. A couple slides ago, Kim also gave you the email address that goes to that same office. And at the very end of this presentation, we're going to give you both of those again. So go ahead and use any of those. You don't need to write this down now because we're going to send you a copy of the PowerPoint tomorrow. Okay, another true-false question. My child cannot receive their first IEP because the DOE is not conducting full evaluations. And then, oops, I didn't just do that. And then the second question, I can request changes to my child's IEP even if the DOE is not conducting full evaluations. Pretend you didn't see what I just clicked a minute ago. Giving you a little extra time since it's two different questions, I think. Okay. So this is really interesting, right? That's exactly right. The first one is false, and I'll talk about it in a second. The second one, that you can request changes to your child's IEP, even if the DOE isn't conducting full evaluations, is true. So on the first point, as Kim talked about before, there are a whole lot of other things that the IEP team can take a look at, right? So you can develop an IEP even without everything in place right now. It may be that at some later point, when there can be a fuller evaluation, that the team wants to come back together. You don't have to wait for a full year. But all those other things that Kim talked about, right? Prior testing, report cards, teacher observations, your input as a parent, things that happened when the school was providing response to intervention or AIS services, all of those can come into the conversation in the IEP development process. On the second question, I can request changes to my child's IEP, even if the DOE is not conducting full evaluations. If you're seeing things in your work with your child right now that are of a concern to you, you can ask for changes. You can request a new meeting. You can request further conversation. You can come to them with suggestions. It's going to be up to the team, but you can absolutely request those changes. And the fact that everybody is in a different place right now, that learning is remote, that evaluations are remote, doesn't change that right. Okay, IEP meetings and recommendations. So a few things, right? The IEP is going to be built upon all of these things, right? If there's a prior IEP, if it's current, teacher reports, parent reports, current levels of progress. IEP meetings, I just sort of want to step back for a second, but IEP meetings are intended for you and the rest of the team to think about what your child needs to support them in school. Remote learning plans, which we're going to talk about in a minute, are not new IEPs. They're plans for making as much of the IEP viable during this period of remote learning. But the IEP meeting, as we said before, it can still happen. So there are two different IEP meetings, or two different kinds of scenarios, right? There are initial IEPs where your child's never had an IEP before, and maybe you've requested evaluations for the first time and the team's gonna come together. There are also reviews if your child's had an IEP for a while. So if it's an initial IEP meeting, the schools are gonna use all of the information that they have available, whether or not there's been the cognitive testing, but they have all of these pieces that you're looking at right now. And they're going to use it to determine eligibility. Does your child have a disability? If so, does it keep them from progressing? If so, what supports and services might be helpful to them? If it's a review, if your child's already had an IEP for a while, the school is still obligated to consider whether or not the IEP is working, if your child was benefiting from the supports and services that were laid out in the last IEP. You and the rest of the team can come together and make a different recommendation based on what you're seeing now, what you've been seeing this year, what the school has been seeing this year, and on all of these pieces. There's nothing about remote learning that changes that right now. Once the schools reopen, it may be that the team wants to come back together and consider new circumstances, consider new evaluations, reconvene the team and make a slightly different recommendation, or confirm the recommendation that you make now during this remote period. But if you have an IEP meeting now and recommendations are made, you don't need to wait for the full year till your next annual review to rethink it, particularly since things are so crazy during this remote time. The other thing I wanted to say here is that, as Kim said before, we were hoping for more information on evaluations at this point when we schedule this, but things are changing, and the DOE could post guidance or identify a way to do some of those evaluations remotely, more of those evaluations remotely as things move forward, and we don't know how long we will be doing remote learning. So in the very beginning, we posted information about that running blog that we have on AFC's website. Keep checking back there. We will share information if there's more information and if evaluations are being done differently at some point in the near future or the not so near future. Okay, we wanted to offer you guys some advocacy tips. You'll see on the left-hand side, it says call AFC's helpline under a whole lot of circumstances, right? So if the school refuses to conduct an IEP meeting, if they won't recommend services until the schools reopen, or if until evaluations are conducted, if the school says they can't consider any changes to the IEP until the schools reopen or evaluations are conducted, all of these, as we're talking about today, are not answers you should be hearing from the school. You guys are on this webinar because you are super advocates on your own behalf, but sometimes you're going to hit a wall, and that's why our helpline is there. So go ahead and reach out to us. I also wanted to say on this slide, even though we don't have it up, that if, back a slide or two ago, we talked about, my cat is about to join the webinar. I'm so sorry, everybody. We talked about getting copies of evaluations ahead of your meetings. If the school hasn't offered those, reach out to them. Really important, because you want to look at those before you get together with the team, either remotely or in more typical times in person. You don't need to read everything on here right now, but we've given you a couple screenshots here of remote learning plans. We want to talk about the difference between remote learning plans and IEPs. So the IEP, as many of you know already, and I think that we didn't ask, but but I suspect that a number of you already have IEPs for your children. The IEP lays out the supports and services, the special education supports and services that your child's going to get during the school year. School year either being 10 months or 12 months, depending on your child's needs. The remote learning plan is not a new IEP. It is a document that you have a role in creating, just like the IEP. And it basically lays out the services your child's going to get now during this period of remote learning. It does not replace the IEP. It doesn't mean that when the schools reopen, your child gets only the services that have been laid out on the remote learning plan. Some supports and services are going to be difficult to deliver remotely, so the remote learning plan is going to look different from the IEP. When you get your remote learning plan, and hopefully you have, which is one of the reasons we've given you the screenshot, this one has things blacked out, but yours will be specific to your child. Take a look at it, make sure that the things that it lays out actually apply to your child, that they're the things that you agreed on with your instructional staff and your service providers. One of the things I wanted to mention here is that specialized or special classes, so classes with only students with disabilities, or ICT classes, integrated co-teaching classes, where a little under half of the students have disabilities and IEPs. Schools, according to the guidance on the DOE's website and guidance that the DOE has shared, are still required to make all efforts to have students continue with the same providers that they had when they were in school. So if your child had a special education teacher, they should still have that special education teacher. If they had a paraprofessional, they should still be working with that paraprofessional, assuming that it meets your child's remote learning needs. All right, another page from the remote learning plan blown up a little bit bigger. You also want to take a look at things like English language learner status, right? If your child is an English language learner, then you want to make sure that that doesn't say no, like our example, but it says yes. If they're using technology, if they have assistive technology, or if they have various modifications and accommodations, you want to make sure, if they need them for their period of remote learning, that they're laid out here in the remote learning plan. The remote learning plan, just like your IEP, is a living document, and it can be changed. So if you've had it in place now for however many weeks it's been in place and it's not working for you, you can reach out to your teachers, your students' teachers, and to your service providers, and you can review it. You can modify it, you can change it to meet the things that you know to be true for your child as a remote learner at this time. And if something's not working, we really urge you to reach out to them and to ask for it. You don't need to just sort of continue with this if it's not helpful to your student at this time. Okay, one last page from the remote learning plan is the program page. So, I mean, while you're looking at this, I'm going to talk a little bit more about related services, actually. So related services are going to be provided online when possible and appropriate, according to language on the DOE's website. Sometimes that's going to be online. Sometimes it's going to be on the phone. You may have a child who, for example, needs less screen time. So by phone might make more sense in that case. Providers should be helping you and your child, not just giving you work to give to your child. They should be instructing, they should be providing. They should, however, be giving you information and activities to do there in your home with your child or wherever your child is. Maybe they're in the rec center, but things that are meant to sort of support and reinforce the work that they are doing with your child. You're not the new teacher, you're not the new related service provider, and here in the remote learning plan, you're going to get information about all of that. A couple other things I wanted to mention just before I move off of this. If your child gets assistive technology when they're at school, they should have that assistive technology available to them at home. And that should be, as we showed a few pages ago, it should be on the remote learning plan. Same for paras. One exception, and it's not really going to be in the remote learning plan, but I wanted to mention it here, is that if your child has a nurse at school, a one-to-one nurse, they should still be getting one-to-one nursing during the presumptive school day. So the Office of Student Health should have reached out to you at some point in order to discuss that and figure out if you want one-to-one nursing in your home. Okay, I wanted to talk now about implementation. So we were talking about sort of building the IEP and building the remote learning plan, but how are things actually going to work, right? So all services are going to be remote except for nursing, as I just said. The provider should be reaching out to you. Actually, they must reach out to you to make that plan. If somebody hasn't reached out yet, and we're pretty far into this remote learning period, you want to act on that. You want to reach out almost immediately to the school and to the providers. And if you're not getting anybody available through the school, we're going to talk later about sort of ways you can work up the line and reach out to other people who can help you with that. As I said before, you must have a chance to provide input into that plan, both initially and then in an ongoing manner, right? So it's not a once and done or one and done thing, but if you're the one that's home, you're the one that's working with your child, you're seeing them online with their teachers if they have live instruction, you're seeing them do the packets that are being sent home, you're seeing them working with their related service providers, you are going to have input and thoughts about it, so you can continue to offer those as you move forward. Implementation during COVID-19 with regard to new placements. So this is a funny one, right? Because nobody's in a placement right now, or very few students are in placements right now, but new placements are still an option. If, as a result of the IEP meeting, you and the rest of the IEP team decide that your child needs to switch schools, it's going to work the same way, at least in part, as it always worked. This is also true if your child's at a transition point, if they're entering kindergarten and they have a disability in an IEP, if they're moving to middle school or to high school next fall. The school is still going to, the school or the CSE is still going to send a school location letter. It's going to come almost certainly via email and snail mail at this point. So again, as I said before, you want to make sure that that your current email and mailing information is available to the school and to the CSE. If you've moved or if you've changed email addresses, go ahead and update that. The new school is going to reach out with a contact number, theoretically. That contact number actually has to be one that allows you to reach somebody that's at the school and allows you to reach somebody that can answer your questions. When they do that, they're going to help you set up a meeting with a couple people from the new school. So maybe the principal, maybe the parent coordinator, a teacher, maybe your child's teacher if they know who that's going to be. And you're going to have a chance to ask them questions, and they're going to have a chance to talk to you about things, because in more typical times, we would be recommending to you that you go to the school and you look at the school and you talk to them and you ask your questions in person. not possible right now. There are some schools that I understand are trying to set up sort of remote tours. That requires that the people from those schools can get into their buildings currently, and that's not always going to be possible. So you can't visit the school right now, but you can talk to the staff there and you can ask them all the questions you would ask them if you were asking them in person. Okay, timeline. So this is how it works typically. The DOE has 60 school days from the time that you give your consent to evaluate them, to hold the evaluation, to hold the IEP meeting, and then to put services and any new placement into place. That's a little tough right now. This next slide is lays out really what you still have the right to do. So you still have a right to a placement before the start of school, and whether that is for your child next September or this July, or even right now, if you're having an IEP meeting and talking about a change of placement, it's pretty late in the school year, so mostly we're talking now about July and September. So July if your child has 12 months of services. If you do need a placement now, the DOE needs to find you one as soon as possible. As Kim talked about before, New York State has passed emergency regulations that give the DOE leeway in this. They extend the timelines during the period that schools are closed. But at the same time, your child remains absolutely entitled to get the supports and services that they need, including a new placement if necessary and appropriate. If you're in this situation and you're finding that the school or the CSE isn't moving as quickly as you need them to, and if you don't have a placement that is set up in time, so as we move on in a couple of weeks, if your child is supposed to be starting a new placement in July and they don't have a placement, call our helpline, but also when we talk a few slides from now, escalate it up the DOE chain. But this is exactly what our helpline is here to help you with. These are really technical. So we want you to know sort of that in the Know Your Rights bit, and this is actually a little bit skewed as a result of that the changes in the emergency regs that I talked about before. But if no provider, no related service provider is available to help your child, you may be entitled to a related services authorization. If no specialized classroom is available, you may be entitled to something called a P1 letter. These are complicated in the best of times, and we urge you, this is another place, we totally urge you to call our helpline and talk to us, or if you have your own lawyer, to work with a lawyer or an advocate. The DOE, even with these remedies, the DOE needs to continue to work to find an appropriate provider in placement. It's not sort of a one and done thing here either. But we do want you to know that these are still out there. We are going to pause now and give you guys a chance to ask questions that I have not been watching the Q&A. I know that Janelle's been monitoring it. So maybe Janelle will answer some of those questions, and then we will open it up to you guys to ask other questions. And then we're going to come back and give you that information that I have mentioned a few times about how you can go ahead and advocate for yourself with all the information that you have.
I have been answering many questions that have been coming into the Q&A, and I do want to go over some of them live with you, even though I have answered many of them in the Q&A, because they're important for all of us to hear. So just bear with me one moment. So we did just cover this, but I think it's really important to emphasize a lot of people have asked questions about the 60-day timeline. And unfortunately, that has been something that has been suspended because of COVID. And so it is important for us to understand that while the district might not be required to comply with some of the rules or regulations that they had to before, they do still need to provide students with placements and programming as soon as possible. And as Maggie said, a student needs to have a placement for them to be in school. So these are things that you still need to think about. In terms of the evaluations though, things are changing, things are fluid. We're not sure how they're conducting some evaluations and not conducting others. But you should be having IEP meetings in response to any requests that you have
And
made.
just to clarify, because it is really confusing, there are two different 60-day timelines. So the one Janelle was just talking about and Maggie was talking about, the 60 calendar day timeline, which is in New York State regulations, is the one that was waived. So if it's a re-referral for a child who has an IEP or an initial consent for a child who doesn't have one, they have 60 school days, which means, you know, any day school is closed, spring break, whatever, that doesn't count. So that can be kind of long. They have 60 school days to implement, to create and implement an IEP, meaning giving, you know, sending you a placement letter or arranging for services, I should say. So sending you a placement letter, creating the IEP, lining up related services for you. That 60 school day timeline is the one that the state has suspended. But confusingly, the federal law still does apply that says they have to do it as soon as possible. And then depending on the situation, if it's something where you could get remote services now and it would be effective, you could argue that as soon as possible means now. We're not waiting till September. The timeline that it's still in effect is the 60 calendar days for the date of from consent to completing an assessment or an evaluation or determining what information they need to hold an IEP meeting. That's still in effect. The confusing part is which assessments can they do now is a little less clear. Hopefully that makes sense. It really, it's almost, I don't know, it's great that you're all asking a lot of questions on this point because it's the same ones that we're tossing around at Advocates for Children, and they're really good questions. And I think fundamentally the most important part will be just to advocate for what your child needs now and to be really clear on that part and ask for them to do something as soon as possible and try to be creative.
A couple other questions that have come up. Number of people from District 75 schools, also for preschools, have asked, you know, am I supposed to have a copy of my remote learning plan? Yes, you are. You should have a copy of your remote learning plan. And if you don't, you should be contacting your school. In a couple slides, we're going to talk about like who you should contact and the order of which you should contact people, but you should contact your school or the DOE's special education office to notify them that you haven't received a copy of your remote learning plan. Remote learning, as all of you I'm sure know, has been has required a lot of parents, and so you should have your copy of your remote learning plan so you also know how to support your child at home. Another question that was asked is, you know, my child is supposed to receive ICT services and they're just sending us video lessons for that grade with no differentiation. How should it look different for a student in ICT? Students who are mandated to receive ICT instruction should be receiving instruction from a general education teacher and a special education teacher. So the remote learning plan should include some form of instruction from a special education teacher. And if all your child is receiving is video instruction, then you can and should advocate for any inclusion of special education teacher supports on the remote learning plan so that the child has access to a special education teacher. What do you do if your para or your service providers are not reaching out to you? All related services should be provided remotely unless there is some reason why it can't be provided remotely. We did get a question about nursing, one-to-one nursing at home, which is a complicated question that I don't think we even have the answer to yet. And so but in terms of physical therapy, occupational therapy, speech and language therapy, providers should be reaching out to families to schedule that. And if they haven't, you really should reach out to your school to let them know that the providers haven't reached out to you so that you can get that scheduled.
And I need to just put one clarification on school nursing. That is complicated. If your child has a one-to-one nurse, you should have been contacted by the Office of School Health asking if you needed that support at home. They have been, and they should be offering. It's the only service that could be offered in your home if you feel comfortable with it. A lot of the parents we've spoken with, if you have one-to-one nursing, you already have a child who has a lot of vulnerabilities. And so you might be the least likely to ask for somebody to come in. On the other hand, you have a child with a lot of vulnerabilities. You might need a lot of help So you might want one. It's a very individualized decision, but in that case, they are and should be calling you to offer one-to-one support, only if it's one-to-one that's on your IEP. And if you're not getting that, certainly follow the advocacy tips, reach out to our helpline. We'd like to try to help you work that through, work that out.
Another question we got is, are charter schools supposed to issue remote learning plans? Yes, they are. Committee on Special Education officers are supposed to be in charge of special education at charter schools, but I believe the response for the DOE has been that they have been allowing the charter schools to create their own plans. If you don't have any information from your charter school about how they are providing special education during remote learning, please reach out to the Committee on Special Education that is responsible for your charter school. And if you don't know that, it is based on where your charter school is located. Where it is located is the Committee on Special Education office that is responsible for special education for that charter school. We also got new placement rules apply to kindergarten as well. So we, as I mentioned earlier, we did a full training on early childhood that includes also transition from preschool to kindergarten. And yes, kindergarten students should be receiving placements. They actually should be receiving them pretty soon, or should have received them already, depending on when their turning 5 meeting was. So if you have not received a placement and you had your turning 5 meeting before March, you should feel free to reach out to, there's now a turning 5 placement email specifically for turning 5 placement concerns that we have available on our website. If you look at that link that we said on the 3rd slide, during COVID, you can find that email address and ask specific questions about kindergarten placements for students who have already had their turning 5 meeting. Okay. If you have, there was a question about providers being on leave, and do you have to wait until the provider returns in order for your child to receive services? No, this district and the school should be replacing the person who is equally qualified so that your child continues to receive services while that person is on leave. And so you can definitely contact your school principal about that. And if you don't get a good response from your school principal, in the next slide, we'll talk about who you should contact after your school principal. Sorry, just looking at the rest of your questions. So if evaluations are being done right now, like we mentioned, they're going to be done remotely. Some evaluations are capable of being done remotely, others are not. And so it really depends on the type of evaluation, the student, the technology available. There are a lot of factors to consider when conducting remote evaluations. If someone asked if they were submitted a request for an IEP meeting back in December and no meeting has been scheduled, that is a problem that should have been resolved before COVID. There's no reason why you shouldn't have had an IEP meeting before COVID happens, because you asked for it in December. You can feel free to reach out to our helpline or to the contact information that we're going to share in a couple of slides to ask why you have not had an IEP meeting yet, and you should still have that IEP meeting now. As we said, all IEP meetings are happening over the phone.
And that 60, I know I'm like the broken record on the like truly technical thing on the 60 school days piece, but that is also violated. I counted backwards from, what was it, March 16th and it's somewhere in mid-December is 60 school days. So if you put in that request in November, you're definitely, they violated that as well.
There's another question about SETS, which is Special Education Teacher Support Services during the pandemic. Students should still be receiving SETS during the pandemic. And so if your child is not receiving SETS right now, they should be receiving it, and the district should compensate them for any hours that they've missed that are mandated by their mandated by their IEP. There's no reason why students shouldn't be receiving SETS during the pandemic. if you have any, sorry, just reading more. We've got like 30 questions. I'm trying to speed through them to get all of them. So someone also mentioned that schools aren't automatically sending IEPs through emails. They should be. Parents should be receiving their IEPs. They shouldn't have to request it. Parents should be receiving their IEPs either through email or through mail after an IEP meeting has taken place. And so if that is the case, obviously you should request it if you can. But please let us know, who's saying that you will only receive it if you're requesting it, because that is incorrect.
And just to jump in there, I mean, that's something that we see in non-COVID times as well, right? Families don't always get a copy of their IEP. You have a right to receive a copy. And as Janelle just said, if you don't get it then or now, or again when the school's open, you should ask for it.
There's another question about Head Start programs and remote learning plans. So remote learning plans also apply to children who are receiving special education in preschool. There are preschool, there's a version of the preschool remote learning plan. There's more information on that on the training that we did last week regarding early childhood, which we will, given the number of questions that we've got, when we send out the slides for this presentation, we will also send a link to the YouTube recording of the presentation for early childhood. I think, Maggie, we can go forward and I will answer these as we go and interrupt you if there are any more that are important.
That sounds great.
Okay.
Okay, so what we wanted to do next, except my computer seems to have frozen, guys. Okay, is talk to you about, sort of who do you call. What we've been talking to you about is how things should be working to the extent that we know how they should be working right now. We're giving you all the information we have, but who do you call when they're not? So the first place is to start with the school, right? Speak to, if you can get them on the phone, or if you can get them by email, your parent coordinator or your principal. And then you're going to sort of work your way up to your district superintendent's office, and specifically there, either the family support coordinator or more likely the district family advocate. From there, you can reach out to your borough support organization and talk to the administrator of special ed. And from there, and we've referenced this a few times, DOE Central has an Office of Special Education. And we have given you in different places, and here it is again, a direct number to them or an email to them. They monitor that email box, and you, even if you don't get an answer, a substantive answer immediately, within 24 hours, you should at least get a recognition that they have received your email, so you know that they're looking at it. But all of your questions about all of the things that we've been talking about, when they're not going as they should, if a school says we can't do an evaluation, if a school says we can't hold an IEP meeting, if the IEP team says, yeah, this is all good and well, but we can't do anything until the schools open up again, all of these are places that you might want to sort of work your way up this chain. We've given you a link right here for information about schools, superintendents, and the borough support organizations. Contact information can be found right here. We also wanted to give you, we titled this Advocacy Tips during COVID-19, but actually they're probably all good advocacy tips for any time. Pay attention to timelines, right? Listen to Kim, she is our expert on this, but pay attention now and always. Keep a list of anybody that you've spoken to at the school, at the superintendent's office, at the borough office, or in Central. You want to know who you talk to and when you talk to them so that you can reference back to it, and it'll help you track those timelines. Keep copies or ask for copies of your IEP and your remote learning plan. Janelle just covered a question about the IEPs. You should have a copy of your remote learning plan too. So when I had the slides up earlier and I was talking about check your remote learning plan, you can only do that if they've actually shared it with you. And it's a really important document because it lays out what they are doing or what they're supposed to be doing right now with you and for your child. So read those, keep copies of them, track the services your child actually gets. Just like in non-COVID times, your child may or may not be getting everything that the remote learning plan says they're supposed to be getting. You want to know if they're not, and that's going to be a reason to reach out to somebody, back on that previous slide. And reach out to the DOE for help. That's why we gave you the slide before. We probably should have written here, reach out to us again, reach out to our helpline for help. So if you do these 5 things and it's not working, go ahead and reach out to us. Our helpline is open and we're sort of still here and eager to help. We're gonna wrap it up, but let me just pass it back to Janelle in case something else came up when she was reading.
Couple of things. So there was a question about independent assessment authorizations. Right now, the district is saying, you know, they don't really have set regulation or plans for evaluations. There was a question about an evaluation that started and then could not be finished because of COVID, and the district refusing to share the results. The district should share the results of the part of the evaluation that they did, to see if you guys can have an IEP meeting and make a recommendation based on the results that are available right now. It's unclear if you would be entitled to an independent assessment authorization, because we don't know if any independent provider would be able to provide an adequate remote evaluation either. I think it's a good question if you could find a provider that's willing to do the testing and say that they could do adequate testing remotely, and request the independent and see what the district's response is. I think it is an interesting thing to consider and to ask for. I think their response though is going to be no one is doing these evaluations remotely, which is why you can't receive the authorization. So if you're going to ask for it, you should probably try to find someone first who says that they're capable of doing it. Because if you ask for it before then, they're going to tell you that no one is doing the evaluations.
And if you need support for the fact that you have, I think, Janelle, that's absolutely right. It's really good advice. And from what I've heard, a lot of psychologists, private and probably DOE, and in many other states from what I've seen, are really trying to figure out what can they do remotely and what is valid and what makes sense. But if you need support for why you have a right to one, the fact that that 60 calendar day timeline is not blown, and that you would have a right to get an independent evaluation, there is we can try to put it in the chat, I'll try to find it, but there is or maybe we'll send it in when we send out the PowerPoint, we'll put it in there, but the Standard Operating and Procedures Manual, the DOE does have a section on that says, you know, if you haven't gotten one within the 60 days, you have a right to an independent evaluation assessment.
Another question that came up regarding assistive technology, FM units, but also other services recommended in IEP, like weighted vests, anything like that the child needs in school and that also may need at home in order to access their remote education, they should have at home. There's a comment about FM units being locked away in a secure location and parents not being able to have access to them. That please call our helpline or email us, because that is not something, you know, if your child needs an FM unit at home in order to access remote instruction, or if you need a weighted vest at home in order for your child to participate in instruction, those are things that you should be able to receive at home through your remote learning plan, so that your child can effectively participate in their education at home. How long should it take to get the special education file during remote while schools are closed? CSIS, which is the DOE's electronic system for records, staff should have access to it remotely and theoretically should be able to email families at least the records that are in CSIS to parents. I will say I submitted a records request in the beginning of this and have not received a response yet. But theoretically there is access to them. It's remotely, and so parents should be able to get access to those documents during COVID. Will schools accept remote evaluations if done? They should. They should consider them. and this is always a case, whether it's during COVID or not, evaluations that are conducted outside of the district should always be considered by the district. They don't necessarily have to be accepted, but they have to be considered. And so if you are able to find someone who's willing to do a remote evaluation and you want to share it with the school, you definitely have a right to do that, have a right to the IEP meeting for that. The district isn't required to accept it, but they are required to consider it. Do we need to hold a meeting to have a remote learning plan, or is it the same as an IEP on a modified form? There should be a meeting with the parents to create the remote learning plan, mainly because remote learning has a lot to do with what the parents have at home, what they have access to, how they can help their child participate in instruction, what technology is available. There are a lot of questions that schools aren't going to know the answers to based on a child's IEP, and so they can't mimic the same document. It is different. And so there should be a meeting and a discussion with the parent creating a remote learning plan. The same way there should be a discussion with the parent creating an IEP, but even more so with the remote learning plan. So sorry, 1 second. Going to a couple more. Yeah.
We're glad you guys are so engaged and had so many questions.
Yes, and thank you for your patience and my answering these questions as they're coming in. There's a lot of them. What services are not being offered because doing them remotely is not possible? That's a great question. I think the district's position has been for the providers. So for example, for related services, providers and the families should be discussing whether or not the service can be provided remotely. And if it can't, there should be an explanation as to why it can't. For some students, remote services are going to be difficult, but for other students, they're not. And so I don't think that we can blanket say occupational therapy can't be provided remotely, because that's not true. It can be provided remotely for some students and it might not be able to for others. But to the maximum extent possible, related services and other services like special education classrooms, integrated classrooms should be provided remotely. And I think this is a time to encourage schools and parents and educators to be creative. Think about how we can do this remotely in a way that the student is benefiting from it. It's very challenging for educators, I'm sure. It is extremely challenging to figure out how to do this remotely for families and for educators. And so as parents and as educators, thinking creatively to figure out how a student can really access services is important.
And to check back in, I would say, because unfortunately when this first, actually I think still is the case, many of the parents we're talking to have not seen, or a lot of them haven't even heard of the remote learning plan. Definitely make sure you get a copy of that and look at it and see if you agree with it. If you weren't consulted about it and you think it doesn't work, or even if you were consulted about it and you want to reconsider it, this is a great time to do that. I think the number one service that and so there, as Janelle said, there is no service that should be off the table. I think from what my understanding is that physical therapy was the least used remotely because it is so, intensely personal and physical, but it is something that some parents did really want it and could be coached through how to do something and really needed to learn how to work with their child. And other people just said there's, not enough hours in the day and that just doesn't seem like it's worth it.
And particularly if you were one of those families that worked with your school to develop your remote learning plan early on, you've probably learned a lot over the past weeks about what works and what doesn't. So it's really valid for you to reach back out and reconsider the plan.
There was another question about the difference between P1 and P4. P is what used to be called the Nickerson letter. It's a voucher for a student to be able to attend the non-public school at the expense of the district for the district's failure to comply with certain procedural requirements. A P4 is a letter or a voucher that allows payment for SETS services. So special education teacher support services. SETS is issued with a P4, not a P1. A P1 is for a school, a P4 is for SETS.
And it comes with a P3, P4 combination. So if you're like, wait, I have P4 comes with a P3 and a P4 come together. It doesn't, yeah, they're different.
My son was supposed to receive an AT evaluation before COVID and it was never conducted. What can I do? That's a problem. You can and should reach out to the DOE central office, the special education email, and see if they are willing to conduct it remotely. I think it depends on the type of AT evaluation, whether or not they will be able to conduct it remotely. I will say though, that once you're found eligible, or if you're found eligible after having the evaluation, you can go back and say that you're owed some sort of service for the time that was missed pre-COVID because they didn't do it before then. It depends on the timing and a lot of other factors as well. Can you do a speech evaluation remotely if they refuse to finish it? Okay, so this was a question about an evaluation that was completed in part. I do think you are entitled to receive the data that was already completed, and I really suggest calling our helpline or emailing us so we can help you get that data, because there's no reason why you shouldn't be able to access at least part of the evaluation. So I think this is from an educator asking, only 15 of her 31 children are receiving remote instruction. How can I assist parents to receive their services? Any remote instruction or special education remote instruction, either way, the district should be providing devices to parents, and parents can request devices. The link is available on the district's website. It's also available on our website. And parents should be reaching out to, well, they shouldn't have to, but if they're not getting any services, they should reach out to the principal. And if the principal isn't responsive, they should be reaching out to the superintendent's office to explain that their child has not received any remote instruction. All students should have been receiving remote instruction since March, and there's no reason why they shouldn't have been.
Also, if the question is, because I've seen this in other webinars, if the question is you're a teacher for the DOE and you're not getting responses from people, you should be speaking with up the chain about how to get social workers involved possibly, or try to understand why the family can't do it, depending on the student. For many students, I have one of those students myself. My son needs intense one-to-one help. There's no independent about how he works. He has 3 people working with him all day long at school. He has a nurse, a para, and often a special educator or a related service provider working with him. So it's really intense to do that at home. I think one thing to keep in mind is that for families who are trying to, maybe the parent is also trying to work remotely, or they have multiple kids, if that's the issue, this is really the time to be flexible, reach out and try to understand and come up with something creative that could work for that family. Because that's a situation we have heard about a lot, where parents are saying, there is no way I can keep up with supporting my child with this. And so those are the tough situations. And I think that's why the DOE is trying to figure out summer school and compensatory services, especially for families who are in that position.
And just like the IEP is individualized, so too is the remote learning plan, and so is going to be the experience for each family. So you're going to have a different set of factors that feed into the family's ability to implement the pieces that they're responsible for, right? There are language barriers, there are technology barriers, you have parents who are working, you have families who have multiple students. So I think it's really important to understand sort of the big picture and work with that big picture to figuring out the best way to get the services and the instruction to those students.
Just a couple more and then we're done. There are good ones, and so I hope you stick around to hear them. A student who's receiving group literacy support in school should still be receiving group literacy support during remote instruction. Yes, via Zoom, or so the schools are using different modalities. It could be Zoom, it could be Google Hangout, Meets, but they should still be receiving that remotely. can a new service be added onto a remote learning plan that was not in an IEP? Yes. I would argue yes. If your child needs something that they don't necessarily need in school, but they need it at home in order to be able to participate in remote instruction, then that's a conversation that should be had when creating the remote learning plan. And it arguably, yes, can be added. I do think though that you're going to need to explain why your child might not need this in school, but they need it while they're home, and what the distinction is for that.
And if you're asking if the new service can be added now and extend into the return to the school buildings, then you want to be looking at changing the IEP.
Yes. Someone asked a question about progress. So, the annual review should be based on what was happening during the school year, or like now when it's a little bit harder during remote learning. And it is, and they asked that it's not equal, and it's not, right? This is definitely a really challenging time for students and for educators.
Sorry.
And it isn't the same. It's not the same. It's not the same. And I don't think anyone wants to pretend that it is the same, because it's not. And so when you're doing annual reviews, you do want to consider and think about what the student is struggling with based on their academic levels and why they're struggling and the reasons for them struggling with it. Is it because of the nature of the instruction being remote and they started struggling with that now, or is this something that they've always struggled with and now it's worsened by the fact that it's remote instruction? Okay.
Yeah, and an obvious thing would be counseling, right? You have a family where people have been really sick, may have died from COVID, and a teenager is not connecting. That would be a great thing to add onto a remote learning plan if that's something that can happen, right? Or a younger kid, whatever. But we've certainly seen situations like that where flexibility and creativity are so important right now.
So one more question that is really important, students that are aging out before during this current school year, what is being done? We don't have an answer yet, but a lot of the advocacy community has been advocating at the state level to extend eligibility for students who are aging out during COVID and that may not be able to have access to certain things that they would have needed to finalize their education, whether it be, it doesn't necessarily have to be a student who's Regents bound, right? Whether they're pursuing a CDOS, whether they're pursuing a Regents diploma or a local diploma, or whether they are pursuing any sort of credential to end their education. What happens when they age out during this time. And there's been a lot of advocacy around trying to extend and allow those students to be able to continue to have eligibility when schools open up again. There isn't an answer yet, but there is discussion about it.
And there's a new answer. Are you going to touch on the new answer that came out? So it's not about aging out. It's about younger kids, but let's say you have a 19-year-old or a 20-year-old who you had hoped would be in school till they're 21, and that they are, the way in which they might graduate would be through a CDOS or a Regents, like a local Regents or something like that. If you were thinking that you would have extended timeline, and now with the Regents exceptions, you wouldn't, because your child was going to sit for the ELA Regent and they are now deemed to have passed it, but you didn't think they would have passed it before. I know this is complex. This is like the super advanced, but if you're a parent of a kid who fits in that category, you know what I mean? There's now, as of last night, the state put out a memo saying you can say you don't consent to the COVID exemption, if that makes sense. So because of COVID, they've waived a bunch of stuff for students who fit that window now. And they've said if that's going to hurt your child, you don't have to accept it. That's only good if your child is under 21. I think that your child is aging out this year is a really valid and important question. And I think Janelle just said this, but please write in about it. We're working, trying to work on that issue.
So I think I covered all the questions that were general enough. I will go back to try to, yes, I think I did. So right now we're going to please ask you to fill out a survey to let us know how we did today. We're would be really helpful if you did do this. And we're also going to open the chat for you guys to put in what you, I'm sorry, Kim, can you say?
Yeah, of course. What you learned today, what was most helpful, what you didn't like, and what you would like us to do in the future. We really are trying to do these every week or two. We've been amazed at the demand for them. People really are signing in. We hadn't done a huge number of webinars before. I think for a lot of us, we've all suddenly become much more adept than we ever wanted to be at this kind of like Zoom life. But please let us know what you liked, what you didn't like. The feedback really, really helps us, and also what you would like to hear about in the future. And if we didn't cover your question, please reach out to our helpline, email us, and let us know how we can help. And these surveys, I know that they can be a little bit dull, but they're really important. This one is really important for grants that we get, and the other one, we really read every answer and consider, you know, oh, maybe we should do a training on AT or whatever it is that has come up. So thank you for taking that.
And while you're doing that, the slide that you guys have been looking at the whole time that Janelle did a remarkable job answering your questions, had our contact information, gave you our helpline hours and our email information, and the link to our sort of ongoing COVID-19 blog. So that will be in what we send to you tomorrow as well. I don't think we need to go through it since you've probably been looking at it for a while. Yeah. And then I guess while you guys are doing this, we didn't actually plan this part, but thank you all for being here. We really, you know, as Kim just said, you know, your feedback is really helpful, but so is just knowing that so many of you turned up to hear the answers that we could share on the information that we had today. So we really appreciate it. And, you know, thank you to the parents and the advocates out there and the educators and all of you who are working to support the kids with disabilities right now.
I'm sorry, if you're raising your hand on the call-in listener, it is challenging for us to allow you to speak. I don't think we have that function right now in the webinar. If there's a way for you to type in your answer or typing your question into the Q&A or the chat, we can definitely answer it that way. Okay. Thank you so much, and we really appreciate it. We will be emailing the materials tomorrow, and we will also include the link to our YouTube channel for those of you who are interested more in early childhood, early intervention, preschool special education, and transition to kindergarten. Thank you.
Thank you.